The Chair of Epidemiology now at Deakin University, Professor Catherine Bennett. Thank you, as always, for your time, Professor Bennett. We'll get to Victoria and South Australia in a moment. Let's start with New South Wales. What's your overall view of where that outbreak is at?
Well, they are still holding the numbers. That's the most important thing at this stage, is that you're not seeing the numbers get away from them. They are getting extraordinary testing rates now coming in regularly. They've had 3 days pushing that 100,000 mark. That really helps because it's giving them a very complete picture of what's happening in the community, both with symptomatic testing in the community, and also those workers who are being screened now routinely. It helps not only protect the rest of the city and state from people unknowingly taking the virus out as essential workers, but it also gives a really good insight into how much virus is still circulating in the community. So we don't hear those numbers specifically. They did find cases earlier on, but if those numbers are dropping, testing rates are high, and they're not now finding more and more cases, that probably means they've actually found more cases that were out there than they knew about before. So while the numbers are sitting flat, it's actually probably a more complete picture, and the fact the numbers haven't gone up with that is a good sign. They still have this issue, though, of viruses the virus finding its way into new households, and that's the risk, both direct contact between households, but also via workplaces and other settings. So that's what they're focused on now, to try and close that down, because that's what you need to do to stop seeing these new cases appearing each day, because you've had new people exposed and they're passing it on to their contacts.
Indeed. But at this stage, while the numbers are not coming down, there is some hope in the fact that they're not climbing exponentially. While the lockdown, unfortunately for those affected, looks like it will continue for some weeks to come, the one bright spot is that it's not completely climbing out of control.
Absolutely. And that's a big, bright point. I think we get frustrated when lockdowns don't immediately turn the numbers around, but it shows that it is controlling or stabilising the outbreak, as they're saying in New South Wales. And that's the first most critical step, so it doesn't get away from you. From there, though, it's that detailed work they need to do to understand where transmission is still happening. And if one person picks up the virus at work and takes it home, that's 4 or 5 cases immediately just with that one transmission event. If that household is linked to other households, then quickly that can be 10 or 20 people, as we've seen happen. So if that transmission event is prevented, that's 20 cases you don't see in the next few days. So that's what it'll take. There's not that much transmission going on still with the lockdown in place. This is the opportunity to identify those areas where they are still seeing spread, and particularly to keep working with communities so that they understand that the high risk that's actually associated with households staying connected through lockdown, because it brings in more exposure points to that every person in those connected households. And it also means that if one person brings it home, it spreads quickly to everyone across the family and friends that are there most connected to. So we just need, if those ties could be broken over the next few weeks, this still could turn around quite quickly, while the numbers overall are being held by lockdown.
Pharmacists in southwest Sydney will be able to administer the AstraZeneca jab. We will see more hubs, Kerry Chant said. So parallel to the lockdown, in your view, how important is it that more doses, more jabs in arms are seen in southwest Sydney?
Oh, the more people that particularly get their second shot, those who've already had their first, we can get those second shots out there. That will make a big difference, both to the risk of people being seriously ill. And it won't stop transmission completely, but it will reduce transmission to some degree, particularly after a couple of weeks. So if those people and the people who could get their first dose now, again, every little bit of suppression of transmission, every chance that someone will either need a bigger infecting dose to get infected or is slightly less likely to be infected at a time like this counts. So all of that will actually help the health department in using its contact tracing to close the various clusters that are now appearing across suburbs down. So vaccination, it's not the complete answer because it will take a time to work, but every bit of help that you get from every literally, as they keep saying, every person who's vaccinated just makes it harder for the virus to move through the community. And if you start now, you'll have the benefits of that starting to kick in 2 to 3 weeks. If you've got new people vaccinated, then that will help. It won't fix it completely, but it will certainly support the lockdown and contact tracing efforts.
What's your assessment of the other states? It does look more promising.
Yeah, look, they all had the benefit of seeing how this virus behaved in New South Wales and the risks of trying to manage it only with contact tracing. The fact that we've had documented cases where people were infectious themselves only 30 hours after being exposed. It's that quick, and it makes other responses like the isolate and trace approaches less effective in these settings, unfortunately. So in South Australia, went into lockdown, still had a couple of sites and have had a number of cases now, nearly 20 cases associated with that. But Victoria now, 180 cases, even though they also found out they had an outbreak only 5 days after the whole thing had started. They were right on top of it, still couldn't bring it down, went into lockdown 6 days earlier in the sequence of events than New South Wales, learning from New South Wales experience. And still, we've hit that mark of 180 cases. But you're right, it's looking promising. The cases they've had in the last 2 days have all been linked for a start, so we know how they fit into the outbreak. But also, importantly, these are contacts who seem to have acquired the infection and become infectious whilst already quarantining with known cases. And so that's the most important thing. No new exposure sites linked to these last few days worth of cases. And while we don't want to have other people have the infection, we definitely don't want there to be exposure to others in the community. So the good news there is that they were all quarantining.
And finally, before I let you go, the other importance for this lockdown to work, Professor Bennett, we were reminded of that yesterday with the tragic death of a woman in her 30s. It shows you that this variant does affect younger people. We know COVID has done, but this Delta variant does seem to be even more damaging when it comes to younger people as it is to older Australians.
Yeah, they've looked at this overseas where they've seen, again, like us, the Delta variant's the one that we're dealing with at the moment. And in other settings, particularly where more of the adults are vaccinated and protected, they are seeing the cases concentrated in those younger people. And so what previously was a rare event because you more likely saw people hospitalised who are older, they are reporting a slight rise. Now, very young people, particularly children, have a very low risk of being hospitalised. So as that goes up, it still remains very low. But it's not zero. And that's what we saw in Australia, that we have not even 2,500 cases across states with this one particular variant that's circulating at the moment, and yet we've seen 8 deaths. And to have someone so young without comorbidity is that terrible reminder that we're all vulnerable and that the virus, infection from the virus, is a real risk, and it's now back in our backyard. We're living with it again at the moment, and so that's what we're protecting against with the vaccine program. It's not the low cases we've seen for the last few months and outbreaks we can control. It's the risk that we have a variant like this one that is very difficult to control, and even with these extreme control measures in place, we are still seeing enough cases to see these more rare and really sad loss of life or serious illness. The numbers in hospital, with 8% of cases hospitalised, and we're seeing a third of those cases actually being admitted to ICU, and then on top of that you've got the people who are ventilated, and so this is not a mild illness, and we've got 40% of people who are below 55 in those people who are hospitalised as well. So it's something that we hear a lot of people talking about this being just like the flu. We hear a lot of people discounting serious illness as just being a problem for people with comorbidity. That's actually not true. And we do have a lot of people who live with comorbidity in the community, and that's actually what's translating to the hospital rates we have now. But we also have people hospitalised who don't have comorbidity, and now, as you say, sadly, we've seen the death of someone young and without any other underlying conditions.
Chair of Epidemiology at Deakin University, Professor Catherine Bennett, thank you as always.
Thanks, Kieran.